You're all welcome. Thank you for coming. Today I'm joined by State Superintendent of Education Molly Spearman to discuss the preparation and planning for teachers and support staff in public and private schools, to receive the vaccine. We're also joined by Mr. Russell Baxley, who's the President and Chief Executive Officer of Beaufort Memorial Hospital. Starting Monday, February the 8th, South Carolina residents age 65 and older may start receiving the COVID-19 vaccination shots. As you remember, a few weeks ago, the shots were opened up to those 70 and above. There are somewhat over 300,000 residents aged 65 through 69 in South Carolina, and we know that many of the 70 and older citizens have received vaccination. Now, in the next category, the teachers are the next in line for the vaccine. There's been a lot of discussion about this and the importance of the schools and the importance of learning for the young children. There are some teachers who are concerned about returning to work without being vaccinated, as well as others. According to a recent survey conducted by the South Carolina Department of Education, as follows: 37 school districts currently have a plan to vaccinate employees in coordination with the local hospital or approved health care provider. That's 37 school districts out of 79. 19 have communicated with local health care providers but have not formalized a plan with them to get vaccinations. 25 districts indicated no plan or provided any evidence of creating such a plan. In addition, districts reported employing 1,222 876 educators and support staff this school year. Again, 122,876, of which 57,307 are teachers. Districts project 58%, or 32,265 teachers, will take the vaccine when it is offered. Again, that's 58%, or 32,265 teachers. Today, I'm encouraging school districts that do not have a vaccination plan with the local hospital or vaccine provider to finalize those plans now and submit that information to Superintendent Spearman and the Department of Education. There must be a coordinated effort at the local level to facilitate this rollout for vaccinating the teachers. If a district needs assistance of any kind, hospitals throughout the state are stepping up to collaborate and coordinate vaccination plans with the individual districts. As for supply, it is critical that local health care providers know in advance how many teachers, how many people are coming in who want the vaccine, so they can make sure that they have a sufficient supply of doses to begin vaccinating the teachers. Also, school districts not offering 5-day-a-week in-person instruction must submit a plan there as well. That is the second plan, to open and operate in person to Superintendent Spearman and the Department of Education for approval. We cannot begin vaccinating our teachers without both of these plans and the supplies, so we must act quickly on those plans. As of February 1st, 2021, of the 79 traditional school districts in our state, 27 offered full face-to-face instruction, servicing about 34% of all students in the state. Four offered only remote learning, serving about 3% of the students in the state, and 48 offered hybrid instruction, serving about 63% of the students in the state. Almost every single private school has its doors open every day, as do 92% of our state's child care centers. School districts in our state have received over $1.2 billion in COVID-19 relief from the federal government. They have all the PPE testing equipment and resources they need to operate full time. In addition, the Emergency Management Division has stockpiled all of that PPE by the millions, and it is available upon request, as it has been for months. Hundreds of thousands of people are going to work every day across the state safely. Our classrooms may be the safest places from the virus. CDC director said recently that vaccinations are not necessary to reopen the schools. The Centers for Disease Control and Prevention cites extensive data showing there is, and I quote, little evidence that schools have contributed meaningfully to increased community transmission. Research conducted by pediatricians at the Medical University of South Carolina found no surge in COVID-19 cases in Charleston County Public Schools following the return of in-person face-to-face classes. We know that we have lost significant learning progress for our young people due to simply being out of the classroom. They must be in the classroom to learn. So we must fix this. This must change. It must change now. It must change quickly. And these plans that I've stated are the big step in seeing that we return to full face-to-face classes, and we do it 5 days a week, and we do it safely. Ms. Spearman.
Thank you, Governor. Appreciate your support. From the onset of COVID-19 pandemic, I have relied on the latest data and guidance from state, national, public health officials on when and how we open up our schools. Prior to the start of the school year, we convened a group of education experts to formulate guidance on how schools should operate in the face of the pandemic. The only data that we had at that time was available from other countries and from the spread of COVID-19 in local communities. Today, there's growing evidence from within our state and across the nation that schools are not the super spreaders they were once feared to be. This is largely in part to the hard work and dedication of local districts and individual schools to put the appropriate safety measures in place. The supporting studies have found schools to be safe when they are following key mitigation strategies and they are implemented consistently. Correct use of masks, social distancing to the extent possible, hand sanitizer, respiratory etiquette, cleaning and disinfection of buildings, and contact tracing. Those things that we've heard Dr. Bell say over and over again. She was right. In the summer, we didn't know how it was going to work. Now we do. And that is why today I am rescinding the initial guidance from our Accelerate Ed Task Force report published in June 2020 that bases school operations on community spread trends and data, given the abundance of reports showing how low COVID-19 risk of in-person operations. Rescinding the guidance that talked about the low, medium, high spread. We know now you can operate schools safely even under high spread in communities. A study conducted by the Medical University of South Carolina shows that there has not been a significant surge of COVID-19 in classrooms. Only 1% of students and staff in Charleston County schools tested positive for the virus after the return of in-person school. As for statewide impact, there have been 9,359 positive COVID cases reported in South Carolina K-12 students and staff since September 4th. This is about 2.9% of the state's 317,800 cases during the reporting period. Currently, 646 schools, over half of those in our state, are operating 5 days a week in communities with high rates of spread. Many have been made in this mode of operation since the very first day of school. While many students and families have chosen and are able to successfully navigate a virtual learning environment, so many other kids are struggling. They desperately need to return to school, to face-to-face instruction as quickly as possible. They rely on us for that personal connection, the controlled environment, safety and security that the classroom offers. For these students and families, we need to be face-to-face in a traditional model as soon as possible. Another reason, interim assessment data now has been submitted to the South Carolina Department of Education. Fall assessments that were given back in August, and then those assessments that were given in December, right before the children went home for winter break. Our children are experiencing more significant academic loss. This is most evident at lower grade levels where students are learning the fundamental skills of math and reading. School operational decisions making must rely on the needs of our students and the availability of staff. There may be times, and we're seeing that, where a classroom or a school or even a district has to go virtual due to the inability to staff the school for a short while. I understand that, and we will work closely with school districts with those decisions. Governor just quoted Rochelle Walensky, our new CDC director, who said yesterday schools need to be open, and vaccination is not a criteria for that. Now, I do support teachers being vaccinated. I think our schools are unique and probably as close to the healthcare industry on the impact that they have on our society, on families who need to work, on children who need to learn, on children who need to be there so that we can feed them and support them with their mental health and social needs. I appreciate Governor McMaster's logistical support in helping to ensure that schools are prepared when their time comes. My job as state superintendent is to advocate on behalf of our students and teachers and make sure that that time comes just as soon as it can possibly come. South Carolina cannot afford to delay going back to school any longer. Face-to-face instruction is vital. Families and communities and action has to be taken, and I appreciate the governor's support. The impact of vaccinating our teachers goes far beyond that individual teacher. It encompasses the entire community ecosystem, the livelihoods of all South Carolinians, and the future of our next generation. And Governor, I accept the responsibility that you've given me to make sure that every district over the next few weeks has a plan in place, working with our healthcare providers to do it in an efficient way. And I will work, as I have been, to make sure that every district in South Carolina offers a 5-day face-to-face option for all of our families. Thank you.
Thank you. Mr. Baxley.
Thank you, Governor.
Let me pull this back from you. Excuse me.
Superintendent. On behalf of the South Carolina Hospital Association and hospitals, we continue to stand ready to vaccinate our communities eagerly as vaccine become more available. As more become eligible, we want to work with the school districts in our respective communities to effectively and efficiently vaccinate the teachers and the district employees. As one example, Beaufort Memorial has worked collaboratively with Beaufort County School District and Dr. Frank Rodriguez to collect those that are seeking vaccination within the school district. He has done a survey. We have that survey, and of the 3,000 employees that he supervises, 1,700 have already committed to and want to receive the vaccine. In order to efficiently and effectively vaccinate them, we have worked out many plans, whether it be mass vaccination events at local school sites such as football fields, as we have collaborated with Beaufort County School District to do that with the 70+, at the school sites themselves, or making available to the teachers at convenient hours and weekends opportunities to be vaccinated at one of our 2 vaccination centers across Beaufort County. Again, we look forward to continuing to work with the state and the school district to vaccinate our teachers, and we'll do everything we can to get shots in arms. Thank you.
We'll answer your questions. As you know, as it's been demonstrated by what Mr. Baxley just said, the teachers, the school districts are well organized. They present a unique opportunity for a very efficient moving of the line in and out to get the shots, and that's why this effort is possible. The general public is not as well organized, of course, but that is what opens up this opportunity. But I need to say that the statistics, the progress of this virus around the country and in South Carolina has demonstrated beyond argument, beyond any sort of doubt, that it is the older people, the older citizens who are most at risk and who are succumbing or dying from this virus. About 88% of those in South Carolina who have died from the virus have been over 60, somewhere in the early 60s, 60, 61 years old. It is clearly the older people who are at risk, and we are not going to take a single vaccination away from those who are likely to die from this virus to give to someone who is not likely to die from the virus. It would be unethical and immoral to do that. Fortunately, we don't have to do that. Fortunately, our system is building, the institutions and people involved in getting the vaccine out are developing into stronger and stronger deliverers of the shots. A lot of innovation has taken place, and we soon will be limited only by the amount of vaccine that is coming into the state. As it stands now, we have not used all of the vaccine that is in the state because there are bottlenecks in getting people in and out. But we will soon overcome that. And the Trump administration and the Biden administration are in complete sync in saying that we will continue to grow in the amount of vaccine coming in. As you've heard me explain before, Johnson & Johnson is about to produce one. Janssen is about to produce one, and they may be available next month, or maybe even before that. But the vaccine coming into our state is only going to increase. And we have the National Guard, the Emergency Management Division, of course, DHEC, working with school districts, working with the Hospital Association, the Medical Association. We've got the whole team on the field. And we have a system and an operation and organization that now is working well. It's sluggish in some places and it's frustrating, particularly in the pharmacies. You remember it was frustrating in the hospitals, but we got over that, and we're moving those vaccinations through the hospitals. We need to do the same thing in the pharmacies. We have about 435 different places around the state right now where people can get that vaccination, including the hospitals. But it is a moral imperative that we protect those who are most at risk. We know from the CDC, we know from who said that a vaccination is not necessary to open schools. As Superintendent Spearman said at the beginning, we didn't know what the facts were going to show. We didn't know how this was going to work. There was a lot of trepidation there that should be gone now because the facts have demonstrated that it is not the younger people. It is not the people in their 30s or 40s or even 50s that are at danger. Those at risk are in their 60s, 70s, and 80s, and that has been demonstrated vividly and tragically in South Carolina. So we also know that until just about a week ago, we had how many deaths of young people from age 1 through or up to 20 in South Carolina? Zero. Zero. That's your K-12. 0 deaths. There had been some positive cases. 0 deaths. Last week there was a tragic death of one person, 17 years old, with a related disease. They call it MISC. Other than that, the curve of deaths, of serious illness, is very low until you get to the upper ages. That's why we are determined to see that our elderly population is protected. If they want that vaccine, we want them to get that vaccine. Also has been mentioned in Charleston County, where they have 38,000 students. I think it was there, or another epidemiologist says there's no evidence of spread from the students to the staff or to the teachers. There's virtually no evidence of any sort of spread in the classrooms, and those teachers and staff in the various schools who have gotten the vaccine have gotten it elsewhere, not in the school. There's no evidence of spread in the school except perhaps amongst teachers and staff who've talked to each other. So all evidence says we've got to keep the system that we have now that is growing, is getting stronger, and will only be stronger as we have more vaccines. We've got to keep that moving without interruption. Without interruption. And we have to get the teachers vaccinated, the others we need to get vaccinated, and we are moving in that direction. And so we're making progress in South Carolina, and that's because we have a lot of communication, collaboration, and cooperation among all of those who are involved in seeking to keep our people safe and to keep our people educated.